Okay.
Welcome back, everybody. Well, next month is National Stroke Awareness Month, and here to talk a little bit more about strokes are two doctors from Bellin Health, Dr. Heverly and Dr. Shavy. Good morning.
Good morning.
Thanks, you guys, for being here.
Great to be here.
You bet. And by the way, today's segment is sponsored by Aascend Pain Institute. So, you know, when they have Awareness Month, I think it's a good idea to just, you know, take a minute, think about it, you know, check your symptoms that you may be avoiding, and, you know, that's what Awareness Months are all about. So, Dr. Heverly, let's talk about what is a stroke exactly. You know, yeah, how do you know?
Well, basically, I like to think of stroke as two things. There are the symptoms of a stroke, and then there's the thing that's causing the stroke, all right? Symptoms of a stroke, we want to keep it simple. FAST is the good acronym to think of. Face, numbness or weakness, arm, numbness or weakness, and speech arrest. Some difficulty with speech. If those things come on, and if they come on all of a sudden, think stroke first and foremost.
So what do you do if you see that happening to someone?
Well, the T of FAST is time. Time is of the essence. When this happens, something is happening to us, and we have to act quickly. We want to counteract that.
So basically, call 911 immediately.
Call 911, get to the hospital however you can, get there quickly. If it turns out it's not a stroke, that's great, but you don't want to be left at home guessing, missing a chance to treat.
And I see you brought a little pad and pen. What's this all about?
Well, I like to think of stroke in two things. There are the symptoms of the stroke, and then there's the cause of a stroke. And I'd like to use this as an illustration. Can I draw out for a stroke? Here's what's going on, and this is true for everybody. We all have a heart, okay? Our heart's job is to pump blood, all right? And the blood flows through these blood vessels called arteries to all parts of our body, including our brain, all right? And as long as those arteries are nice and open, everything works just fine. But if something comes along and clogs off that artery, then no blood gets past it. And without blood getting past it, this part of the brain stops working. That's what a stroke is.
Okay. Well, you made it really simple. You know, because it is. It's like, you know, you hear about it all the time, but what is it? So I get it.
This is what's going on in the body.
Okay, so when that happens, hopefully we've caught it early, Dr. Shavy. We've gotten to the hospital, and then that's when the rehab happens.
Yes.
Can you get people back to their same old selves, and how do you go about doing that?
Well, there's a couple of different phases of the rehabilitation after a stroke. The first phase occurs right in the hospital. The therapist starts seeing the patient right away, and we determine what the next best step is. Most of the time, that next best step is to be transitioning to an inpatient acute interdisciplinary rehabilitation program. And that's where the real therapy starts to begin, where we start to focus on neurologic recovery. We train patients on how to use appropriate assistive devices, and we adjust their medications to prevent them from having another stroke, to prevent them from having complications of the stroke that they have just recently had, and also adjust medicines to try to maximize their recovery from this stroke.
So it's a whole team of people. How quick can the process go, though, until these patients are back home and living normal lives?
Well, if you look at regional and national normals, most patients that do go home after a stroke, and that number is about 65%, are going home in about 4 weeks.
Wow.
At Bellin, we've actually moved the bar a little bit on that, and we're getting close to 75% of our patients home, and we're doing so in about 3 weeks.
And success stories, how are some of those patients doing?
Most of the patients that eventually go home are able to continue to care for themselves independently. And in fact, if you were to take a survey of all the patients in this country who've had a stroke, between 70 and 75% of them are managing their own lives, not requiring any assistance from family members or paid help.
That's great to hear. Really great to hear. So May is a time coming up to get in for a checkup. It's been a while, and hopefully a stroke won't happen to you. But if it does, get help right away, and you're there to help. Thanks, guys. Really appreciate it.
Thank you.